back to Good Day, Good Health here on the NASCA Network. I'm your co-host, R. Paige Smith, here with Dr. Michael Sujian. Before the break, we were talking about how sickle cell anemia is transferred, historically presumed to be a disease that affects only African Americans. But today, with so many mixed marriages and how our culture becomes more integrated, as Dr. Mike was suggesting, it's evolving beyond the boundaries of the African American population, although I would assume the African American population is still the highest percentage of those suffering from sickle cell anemia. We're going to talk about what's happening in medical technology that's driving towards a cure. Dr. Mike, talk to us about what's happening in the treatment of sickle cell.
Well, I think one of the most important things has been trying to detect this early on. There's been a realization that preventing infections in young children is a key thing, and the use of antibiotics like penicillin to prevent infections prophylactically.
Now, how young are these treatments being?
Basically, as soon as it's diagnosed, antibiotics are being used, and for most kids will continue till they're at least about 5 years old.
And on average, what age group is that diagnosis?
Well, actually, if we know that parents are potentially affected or potential carriers, the screening will be done right after birth, and as soon as it gets identified, prophylactic antibiotics get started.
Okay, all right. For those folks that diagnosis has occurred, they have sickle cell, and they deal with the crises. Let's talk about the crises. Some of the pain that sickle cell sufferers experience can be excruciating. Let's talk about what you see in the hospital as a doctor who treats a specific illness.
Oh yeah, the most common thing is a so-called painful bony crisis.
Okay.
And it's almost what it sounds like. I mean, the bones hurt quite a bit. Now, in some cases it can be managed at home, but sometimes it gets to the point where the pain is so bad that patients will need intravenous pain medications and end up getting admitted to the hospital.
Now, 30 years ago, I think the life expectancy that was being discussed for sufferers of sickle cell was somewhere around the 50-year-old mark. Has that changed? Where does that stand today?
Yeah, you're right. 30, 40 years ago, it would be unusual to see patients with sickle disease live much beyond the age of 50, 55. But we've gotten better about preventing infections and treating them when they happen. So that's extended life. And also we've become a lot more aware of some of the vascular complications, things like strokes, heart attacks, things like that. And as we've gotten better with dealing with those things, it's really extended things to the point where many sickle patients live well beyond that.
What new technologies have been introduced, let's say, in the last 10 to 15 years?
Well, there's one technology that's kind of an oral medication that's become more and more utilized, an oral medication called hydroxyurea, and that's being used to try and prevent a lot of these painful bony crises, and that makes a big difference. We've gotten to be much better about using antibiotic therapy. That's been helpful. I think one of the things that's sort of on the horizon but hasn't gotten into common clinical practice yet is research that's looking into ways that we can affect the actual genetics of this disorder, either the expression of the production of the sickle hemoglobin or trying to deal with some of the manifestations of it.
Hydroxyurea, let's go back to that. That's also a medication that's used to treat cancer patients.
That's
what
right.
Specifically is hydroxyurea, and what are the benefits that hydroxyurea provides for both cancer patients and those suffering from sickle cell?
Yeah, hydroxyurea is a drug that mostly gets used for treating patients with certain types of blood disorders, chronic leukemias, things like that. But it's been realized that patients with sickle disease that take this medication on a steady basis, the levels of something called fetal hemoglobin can be increased. The production of some of the hemoglobin S, which causes a lot of the problems, can be decreased, and it tends to prevent a lot of the painful crises and other problems like that.
Okay. So when we come back, we're going to talk to Dr. Mike we talked about the life expectancy. We're going to talk about the type of lifestyles that those suffering from sickle cell anemia can expect to live, and if there are any anomalies to those lifestyles. We'll be right back on Good Day, Good Health.